Welcome to the Science Whisperer channel. Influenza, also known as the flu, is a highly contagious respiratory illness caused by influenza viruses. It is characterized by symptoms like fever, cough, sore throat, runny or stuffy nose, body aches, headache, and fatigue. The flu can range from mild to severe and can lead to complications like pneumonia, bronchitis, and sinus infections. The virus spreads through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by touching a surface or object contaminated with the virus and then touching the face. The flu season typically occurs during the fall and winter months, with outbreaks in schools, workplaces, and communities. Getting a flu vaccine each year is the best way to prevent the flu and reduce the risk of severe illness or complications. The flu vaccine stimulates the body's immune system to create antibodies that protect against the flu viruses. It is recommended for everyone over the age of 6 months, especially high-risk groups like young children, pregnant women, and older adults. Other preventive measures include good hand hygiene, avoiding close contact with sick individuals, and covering your mouth and nose when coughing or sneezing. If you do get the flu, rest, drink plenty of fluids, and take over-the-counter medications to relieve symptoms. Antiviral medications may be prescribed in severe cases to reduce the duration and severity of the illness. It is important to stay home from work or school to prevent spreading the flu to others. If symptoms worsen or persist, seeking medical attention is advisable. Certain populations, like young children and older adults, are at a higher risk of developing complications from the flu. Complications can include pneumonia, respiratory failure, and worsening of chronic medical conditions. It is important to monitor symptoms and seek medical help if needed, especially for those at higher risk. Influenza viruses can mutate and cause seasonal outbreaks and even pandemics, as seen with the H1N1 influenza pandemic in 2009. Maintaining good hygiene, practicing respiratory etiquette, and getting vaccinated are crucial in preventing the spread of influenza. The flu can be especially dangerous for individuals with weakened immune systems, like those undergoing cancer treatment or with certain medical conditions. People with flu-like symptoms should avoid crowded areas and close contact with vulnerable individuals. Influenza can be diagnosed with a rapid influenza test or a viral culture, usually done by swabbing the inside of the nose or throat. Treatment options for the flu include antiviral medications, rest, and symptomatic relief. It is essential to complete the full course of antiviral medications as prescribed. Flu prevention strategies, such as vaccination campaigns and public health awareness, play a significant role in controlling the spread of the virus. Each flu season, the flu vaccine is updated to protect against the most common strains of the virus. Despite its global impact, influenza is preventable through vaccination and proper hygiene practices. Educating yourself and others about influenza can help reduce the risk of infection and protect public health. Thanks for viewing this microlearning video and don't forget to subscribe for more updates.